Okay. Good afternoon, everyone. Indiana has experienced its worst COVID-19 surge since last winter. Our positivity rate has risen to 10.8%, fueled by a significant increase in new cases. As a reminder, our positivity rate was just over 2% at the end of June. Since Monday, we have seen more than 20,000 new cases, with increases across all of our age groups. Pediatric cases have risen steeply, with the most significant increase in our 10 to 14-year-old age group, as you can see on the slide. We also have seen sharp increases in the 5 to 9-year-old age group and among our older teenagers. Many of our hospitals are once again struggling with staffing and capacity issues. Nearly 2,200 Hoosiers are currently hospitalized with COVID. Keep in mind that our peak was just under 3,400 patients. And we've seen the percentage of available ICU beds fall again, which impacts every Hoosier in need of critical medical care. Yesterday, we received updated reports on available ICU beds in hospitals across all 10 emergency preparedness districts in our state. 4 of those districts reported utilizing more than 100% of their ICU beds. Those districts were 2, 3, 5, and 10, representing the northern, northeastern, central, and southeastern portions of our state. The majority of the hospitalizations continue to occur among our older Hoosiers. This is the age group in which we have seen the biggest increase. But we've also seen an increase in children being hospitalized. Many of these children are not yet eligible to be vaccinated. To anyone who argues that COVID-19 does not impact children, I can assure you that every parent with a hospitalized child would disagree. This surge continues to be fueled by the extremely infectious Delta variant. Nearly 98% of the new cases we are sequencing continue to be this variant. We only send a portion of tests for sequencing to determine if a variant is present, but this sampling provides an accurate representation of the level of the variant in our state. None of this is good news for Hoosiers. I've heard other medical professionals around the country state that this is the darkest time in the pandemic. Unfortunately, I share those sentiments. I want Hoosiers to understand that this surge isn't just impacting the individuals who are being diagnosed with COVID. It impacts the person who might need a biopsy to see if he or she has cancer, the accident victim who gets held in an emergency room because there are no staff to put him in a room, the person who is depending on a joint replacement to relieve their extreme pain. I saw a photo recently of a young cancer patient from Indiana sitting in the back of a patient's van instead of being inside the hospital where there were no beds for him. It was heartbreaking. We have begun seeing hospitals cancel or postpone some non-emergent procedures again to ensure that they have the capacity for the severely ill or injured. I have incredible empathy for Hoosiers all over the state who are having their health care procedures delayed or otherwise impacted because of the hospital capacity issues. I want Hoosiers to understand that the decisions that they are making affect others. It's incredibly disappointing to have effective tools such as the COVID-19 vaccine and still have nearly half of our eligible population refuse to get it. We will continue to throw everything we have at this surge, but even that presents challenges. This week alone, we scheduled almost 50 different mobile vaccination testing sites throughout the state. In the first 3 days, we provided more than 5,000 tests and administered more than 800 vaccines. Our local health departments administered more than 11,000 tests during the same period. Statewide, across all sites, well over 200,000 tests have been administered this week. Testing in particular is very much needed right now, given the increase in transmission. At some of our sites, we are seeing positivity rates close to 20%. We have 10 mobile units that we take into areas where we are seeing high transmission. We recently created a request form for communities to use if they want one of these units. Once we get a request, we work with the local health departments and the leaders to identify locations that are willing to host these operations. Unfortunately, due to the high volume of people seeking testing, traffic is overwhelming some of the locations that have agreed to host us. Some have requested that we find a different site to ease the congestion and ensure that their regular operations are not disrupted. This means that a 3-day clinic that was planned for a particular location might have to change. In these instances, we are sending text messages and emails to the individuals affected to notify them of the change. We are doing this as quickly as possible, but please understand that many of these changes occur at the last minute, sometimes late at night. We also are trying to get more testing into school settings, both through our mobile units and by offering BioNext Now rapid tests in schools. These rapid tests can quickly assess whether a student's symptoms are COVID or not, and this can help reduce the quarantine and keep our children in school when they're healthy enough to be there. We sent out a survey this week to more than 2,000 schools to ask whether they were offering testing and to offer BioNext Now tests. A total of 318 schools responded by the end of the day yesterday. Of those that responded, 35% indicated that they were already offering testing. 53% indicated that they were interested in receiving BioNext Now cards. We will be working to get those cards to the schools that are interested as quickly as possible. But given the low initial response rate, we estimated that only about 10% of schools across the state are offering testing. We will reopen the survey to give schools that didn't respond another opportunity to express an interest in testing support. These tests are easy to use and can help keep as many children as possible in school and participating in activities. I also want to note an important improvement coming to our school dashboard. Next week, we'll be able to add a toggle feature to the school dashboard that will differentiate between the school years, including showing which schools have reported as required yet this school year. This will show that more than 1,200 schools have not reported this school year as required. I want to stress that these cases must be reported to the state. Unfortunately, we have many more weeks of this high level of activity before we can expect this Delta surge to start declining. And that's why it's imperative that every Hoosier do what's needed to prevent additional cases. Finally, I want to make you aware that once again, the Hoosiers who serve you have answered our call for help. More than 300 Indiana National Guard soldiers have volunteered once again to help with a pandemic response. This includes medics and logistical support to help with testing and vaccination efforts. We also are working with the Bowen Center again to identify additional resources for our healthcare partners. Watch for another volunteer call out soon. We're incredibly grateful for the support and the dedication of these volunteers and all the healthcare workers and public health warriors who continue to step up day after day to help Hoosiers. Now Dr. Weaver has some vaccine updates.
Thank you, Dr. Box. As difficult as the pandemic surge is right now, there is good news. This week, Pfizer received full approval for its vaccine for people aged 16 and older. For many people who were waiting on full approval rather than an EUA, this is your chance to protect yourself and the people you love. Please do not delay. Go get vaccinated. We have noticed an increase in Hoosiers scheduling their vaccine after the announcement this week. Our Zotec vaccine sites saw a 10% increase in appointments. We also received guidance about a third dose for immunocompromised individuals. This includes people who are undergoing treatment for cancer, recipients of solid organ or stem cell transplants, individuals who have advanced or untreated HIV infection, and people who are taking certain medications that suppress their immune system. This recommendation reflects the fact that people who are moderately to severely immunocompromised might not build enough protection when they first get a vaccination. When this happens, getting another dose of the vaccine can sometimes help them build more protection against the disease. This appears to be the case for some immunocompromised people in COVID-19 vaccines. If you fall into these categories, please consider getting a third dose of one of the mRNA vaccines, which are the Pfizer and the Moderna vaccines, and this is 28 days after your second dose. Ideally, you would get the same type of vaccine that you received earlier, but if only one or the other is available, it is fine to get that vaccine. You do not need a physician's order, but will be asked to attest to the fact that you meet these criteria when you receive your third dose. The recommendation for an additional dose of vaccine does not apply if you got the Janssen or the Johnson & Johnson vaccine. If you received J&J as your vaccine, please do not seek an additional dose at this time. We also have heard the federal government has developed a plan to begin offering COVID-19 booster shots to the general public this fall. Implementation of the plan is subject to FDA's authorization and CDC's recommendation. A booster dose refers to another dose of vaccine that is given to someone who built enough protection from the vaccine during their first series. But then they see that protection decreases over time. This is called waning immunity. At this time, we expect those doses to be the same formulation of the current vaccines. Studies are currently occurring with other variations of the vaccine that incorporate the Delta variant, but the new formulas have not been authorized. As third dose and booster doses roll out, we will be working to enhance our vaccine dashboard to capture these data. Studies out of Israel are very promising with regard to booster shots, showing a significant increase in protection, even against the Delta variant. We will have more information on how booster doses roll out once they have received approval and formal guidance has been issued. In the meantime, we remain focused on providing vaccines to Hoosiers who are eligible. In the past week, more than 40,000 Hoosiers have become fully vaccinated against COVID-19, and more than 83,000 vaccines have been administered. The biggest increase in vaccination rates have occurred among individuals aged 12 to 19, followed by those in the 20 to 29-year-old age group. While we are encouraged to see the increase in vaccinations, the reality is that 48% of our eligible population remains unvaccinated. That statistic allows the virus to continue to thrive and puts those who cannot yet be vaccinated at greatest risk. We do not expect to see vaccines become available for children under 12 for several months. So I encourage everyone to use the tools at their disposal to protect those who are most vulnerable. The vaccines continue to be highly effective at preventing serious illness and death. Although the number of breakthrough cases has increased, they still account for less than 0.5% of all fully vaccinated individuals. Hoosiers age 50 and older continue to represent 60% of all breakthrough cases. The number of breakthrough case hospitalizations represent 0.008% of those who are fully vaccinated. And the number of those who have been admitted to the ICU is 0.001% of fully vaccinated Hoosiers. In this slide, the blue line represents cases among unvaccinated individuals in recent weeks, while the orange represents those who were vaccinated. As you can see, unvaccinated Hoosiers are at an extreme disadvantage when it comes to getting COVID-19. The same also holds true for Hoosiers who are hospitalized. Once again, the blue line represents those who are hospitalized and unvaccinated. Here's another way to look at it, and I think this graphic is incredibly powerful because it shows that of nearly 1,300 patients admitted for COVID, only 7 were vaccinated. These trends also are holding true for individuals admitted to intensive care units. Your odds of needing the ICU due to COVID-19 are much greater if you are not vaccinated than if you are fully vaccinated. Again, if you look at it in terms of people, just one Hoosier who was fully vaccinated was admitted to the ICU out of the 205 ICU admissions. The remaining 204 were unvaccinated. We are often asked to show the rates of COVID deaths among people who have been vaccinated versus those who are not vaccinated. Since January, there have been 93 deaths in fully vaccinated Hoosiers, compared to the 2,996 deaths in unvaccinated Hoosiers. Just last week, 115 unvaccinated Hoosiers died. These are sobering realities and illustrate the importance of getting the COVID-19 vaccine. But it is also important that we do not lose sight of those routine childhood immunizations that protect our children even in non-pandemic times. Routine childhood immunizations have fallen significantly during the pandemic. The Vaccines for Children program provides vaccines at no cost to children whose families might not be able to afford them and is a good barometer of immunization rates across the state. The VFC program has seen steep declines in ordering in some counties. The drop-off in ordering has been as high as 77% in some areas, and nearly a dozen counties saw their VFC orders drop by 50% or more. This is extremely concerning, as it signals that children are missing these routine vaccinations, such as those that protect against measles, mumps, and whooping cough. As we try to protect Hoosiers of all ages from COVID-19, we must continue to ensure that we do not neglect those other diseases. If your child is behind on immunizations, please call your healthcare provider or local health department to get caught up. Many schools are also partnering with these groups to hold catch-up events for immunizations. No child should die of a preventable disease because their healthcare was delayed. Do not skip your shots.
Questions?
Yeah.
Right, our first question today is from Nikki Kelly of the Journal-Gazette. I have two quick questions. The first is I wanted you to clarify very specifically on the school dashboard. I think there's a lot of confusion. Last year it was seen as sort of voluntary. Some schools are only adding it if they can say it spread in the school. And also people are getting quarantined, but yet no new cases show up on the dashboard for a school. So I wanted to just clarify all of that. And then secondly, I'm wondering, there are a lot of people not getting vaccinated because they say they have natural antibodies from a previous infection. You guys have a ton of data. Have you been able to show any data that shows how many reinfections we're seeing, just similar to the numbers you have a breakthrough, but with natural immunity from previous infection?
So I'll be glad to answer your first one, and Lindsay, I'll let you speak to the second one. The school dashboard, the way that we decided, it is under Indiana code that you are supposed to report a case in a congregate setting. So that would include Department of Corrections, long-term care facilities, schools, jails. And the way that the State Department of Health chose to have that reported to us was through the school dashboard. We have found that the school dashboard right now reflects last year's numbers and this year's numbers. So that's why we're putting the toggle in so you can separate last school year from this school year. It's a little different than when we talk about other years starting in January. So when we looked at that, it is clear that many of our schools this year are not reporting. We do know because we get lots of calls from school nurses, from parents, from other concerned individuals in communities that there are many students being quarantined sometimes, but not positive cases reported. And other times, even individuals that are positive, if they're asymptomatic, are being allowed to come to school. And those are not being reported to us. So we are working very closely with our schools when that happens and reaching out directly to them and discussing the importance of reporting these cases so that the appropriate number of students can be quarantined and we can decrease, hopefully, the transmission within the schools. The main thing, though, is for students to get vaccinated. And the way that we can keep schools open to in-person training, which is the number one goal for all parents and I believe for all schools, is we want them in schools in in-person instruction. And the main way to do that is layered mitigation. Get vaccinated and wear your masks. Lindsay, anything you want to add to that?
So we have seen reinfections. We have about a 0.5% reinfection rate. And there was a study that came out of Kentucky that showed that people who were vaccinated after they had COVID had a 50% less chance of getting a reinfection. And right now we have just over 400 Hoosiers who had COVID and then got vaccinated and then were reinfected. So it is still important that we're all following the correct measures that we do. But your risk, if you've been vaccinated after you've had COVID, is half that to get reinfected. So it is still really important to go ahead and get vaccinated.
All right, our next question is from Rob Burgess of the Wabash Plain Dealer.
Hello, good afternoon. Good to be with you again. I have two related questions. It's been said that a lie can travel halfway around the world while the truth is still putting on its shoes, and we've certainly seen that with this pandemic. I have to imagine the comparably low vaccination rates we're seeing here, especially in the rural parts of the state, is at least partially due to the rampant misinformation spreading like wildfire, especially across social media. What are you doing to combat this? Because right now it seems like to me that misinformation is winning. And can you and would you discipline doctors and or healthcare workers who spread this misinformation in the state?
So we are working very hard to get the accurate message out there, whether that is from reaching out and educating people through our healthcare providers across the state. We have engaged with the Indiana State Medical Association, with the American College of OBGYN, with the Indiana Academy of Pediatricians to make sure that they are engaged within their communities to get this accurate messaging out there. We are in belief, and at least the studies have shown us, that individuals within a community tend to trust community people with regards to health care much more than they do someone that they don't really know or relate to at the state level. So we've been working with them to get this message out. Unfortunately, not all of them have received respectful or appropriate acceptance at meetings and other things that they've gone to, and that has made it more difficult. We also have all kinds of incredible information on our website, and we link to lots of accurate data and to messaging and articles that are accurately portray what the true data and the true evidence is with regards to wearing masks and getting vaccinated and the risks of vaccines. We continue to talk on a regular basis, as does the governor, across the state, with anybody that we talk to about accurate data and information. Lindsay, what else would you add to that?
I think, people need to talk to their healthcare providers, that these are people who, healthcare is a calling to them. They have dedicated their entire lives to being able to take care of other people and to educate on the people they do take care of about the right thing to do is. So people know where they need to go to get the right information, and we will continue to put it out there as much as we possibly can and to support the people who are out there sharing the correct information.
Our next question is from Brandon Smith of Indiana Public Broadcasting.
Afternoon, Dr. Box, Dr. Weaver. I have two questions. The first is, how is the state working with schools to use federal funding for COVID testing?
So we have quite a bit of federal funding available that we can write to and actually draw down on if we have schools that are interested in doing the testing. We have a handful of schools that last year decided that they wanted to do some testing, and we went out and actually trained them on the Buy an X Now cards and allowed them to be able to do the testing in their schools. And we've seen an increased interest in that this year. But again, it's a small percentage of our schools overall. We believe that this would be an excellent way for individuals that are close contacts to be able to be screened and to be able to be in the classroom longer. We believe that this is an excellent way for individuals that are symptomatic to be screened, because if that Buy an X Now test is negative, they can be back in school. So we are continuing to work with our schools. I understand they are overwhelmed with everything that they've already had to do with this pandemic and trying to educate students across the state. We would really like to be able to partner with more of them to be able to offer testing.
And my second question was a follow-up on something you just said, Dr. Weaver, in response to Rob's question, which was talk to your healthcare provider. So many people, particularly in rural communities, don't have a healthcare provider. So what are we doing to get them accurate information from people that they trust?
So again, holding press conferences like this, we're out on social media. We know that the local health departments in the community are going to meetings, whether it be city council meetings, school board meetings, to talk to people and help share that information. Refer people to our website, coronavirus.in.gov, rshot.in.gov. Both have great information on there. Of course, the CDC website. We get it. We know that there is lots of information flying around there, and I just ask people to go to trusted sources.
Our next question is from Kathy of the Ferdinand News.
Good afternoon. I would like to hear from you guys directly as concerning masking. I know there were two meetings last week. I attended the one, everyone was masked. The board was completely masked. There was a school board meeting then. Nobody was masked except one board member, and the parents were incensed because they're telling you you should mask your kids, but seems to be no clear protocol. I know my 5-year-old granddaughter has trouble putting on her mask. Teacher didn't really want to help her. What's the answer as far as masks is concerned right now, especially for children and for in those congregate settings like meetings?
So the answer right now for the surge that we are in with this Delta surge is that layered mitigation is the answer to this. Number one, get vaccinated so that maybe we can decrease any further surges the rest of this fall and into the beginning of next year. But number two, most importantly, is that layered mitigation where we wear masks when we are in large groups and we are inside. And we have said from the very beginning the middle of the summer, even sooner than that, that all students, teachers, and staff should go back to school and they should be masked. And that would be the way that we would decrease transmission in schools and be able to, along with vaccinating those children when they're eligible, keep schools open to in-person education. And Kathy, I will tell you, my not even 3-year-old, 2-year-old grandson didn't have his mask with him and saw his little buddy cousins that had masks on and came up to his mom and asked for his mask. And we didn't have one that fit him, so we got one of these blue masks, and he put that mask on himself and walked away with his little bitty cousins. So it is about how we approach this with our kids and how we educate them about it and the importance of wearing the mask to keep people from getting sick. Anything, Lindsay?
Okay, our next question is from Courtney from Fox 59.
Hi, good afternoon. So right now, with local officials being tasked with the responsibility of imposing mask rules when it comes to their schools, we're noticing a lot of districts are seeing some of their highest numbers. Counties are seeing a very large percentage of their new cases students. Wayne County today is an example of that, with almost half of their new 80 cases being among school-age children. Is there a conversation on the table with the governor about moving back to a statewide mask mandate among students? And sort of where do those conversations go now that we're seeing just the numbers spike again with this surge?
So there's always a conversation with the governor ongoing about everything with regards to this pandemic. That hasn't changed from day one, and I'm sure it won't change until we finish this. I will say that whether we have a mask mandate in place or not, the bottom line is masking is the mitigation measure that will help to decrease transmission of this Delta variant until we get out of this surge. I'm not talking about necessarily for the entire rest of the fall or even into June of 2022. But for right now, we have to decrease the transmission in the state of Indiana, and masking and getting vaccinated are the main ways we're going to do that.
Next question is from Brock Turner.
Hi, doctors. I appreciate you taking the time today. Dr. Box, I know you just said that masking and vaccines were the two things that, were the two single things that we could do to reduce transmission. But is the state's approach working on sort of having local governments bear the brunt of the responsibility and having individual citizens work? I mean, you said it yourself that we're seeing transmission we haven't seen in months. Is the state's approach working for that? And is it time to reevaluate that?
I think that the state's approach is exactly the right approach, and that is to share with Hoosiers across the state what they can do to decrease transmission of this virus. I will say to you that it has been very clear that our elected officials want the opportunity to make these decisions for the state of Indiana. So we are giving appropriate, accurate, evidence-based recommendations very strongly about how we get out of this surge with the Delta variant.
Next question is from Nikki of WRTV.
Good afternoon. Two quick questions for you. First has to do with booster shots here. We already have immunocompromised Hoosiers that are eligible to be getting their booster shots. We spoke with several that said they've been calling 211. They haven't been able to sign up. What is the state's plan to help those immunocompromised Hoosiers? And I know you're waiting on guidance right now from the federal government for that next rollout, but how can you prepare so you're ready on day one? Also, how many immunocompromised Hoosiers do we know that have gotten that booster shot at this point?
So we've had over 10,000 third doses given since they came out with that new authorization for immunocompromised people. So we know it's probably about 3% of our population, our total population, that would therefore be eligible for it. Honestly, if they're having trouble, most of our sites are walk-in. They shouldn't have to come up with an appointment. I almost want to say all of them. I know very few, maybe just physician offices that are requiring an appointment to get a vaccine. So I would encourage them to go. Additionally, those over 50 sites that the Department of Health is at this week, and we're going to continue that as long as we need to. We're offering Pfizer at every single one of those sites, and Johnson & Johnson as well. But for those people who are immunocompromised and are looking for that third mRNA vaccine, we're out there and we're ready to give it to you. As far as preparation for the booster, so we know we have 3 million plus Hoosiers that will need a booster shot over the coming months. Just today, we're hearing it's likely going to be 6 months and maybe not 8 months that they're recommending for people to go ahead and get the booster shot. Most of our vaccine sites, while they have scaled back significantly, are still out there and are giving vaccines actively. So it's just a process of getting them to scale back up. We've already been talking to them. We've been having discussions, preparing, planning for several weeks now, and not one person has said, no, we can't do it. They just are going to have to look to these volunteers again, call on the outpatients, docs and nurses and other members of the community to come back in and help like they did the first time around. And if I've learned anything, I've learned that Hoosiers step up to the plate when asked. So I expect we'll be fully ready when the boosters are ready for us to give.
And beefing up our National Guard presence again, which is tremendously important for us.
Yes.
A follow-up question just for both of you. As we stand here right now, I mean, we see the data, hospitalizations are going up, everything's going up. We're starting to see another surge. We're not at that peak yet. Do you feel, from both of your perspectives, the state could have done more to put us in a better position than where we are right now?
I don't know how we could have messaged or planned or made available vaccinations any better than what we've done. I'll be very honest with you. The accessibility of these vaccines, our partnership with local public health and with our hospital systems across the state and our National Guard has been absolutely remarkable. So I really feel that we have done everything within our power to make this vaccine available, to speak to the risks associated with the vaccine, which are minimal, and to show over and over again the benefits of being fully vaccinated.
Thank you.
And our next question is from Steve of KPC Media.
Good afternoon. How are you two doing today?
Doing well, thank you. How are you?
Good. Two questions for you. Last night, we got a statement from the Whitley County Commissioners speaking about local officials, and I will read part of their statement here, quoting, "We believe individuals who have been in close contact but show no COVID symptoms should be allowed to attend work or school without interruption," saying that they do not support contact tracing quarantines. I'd like to get your reaction to that. And then second, we've been hearing about the latest supposedly miracle cure, ivermectin, an anti-parasitic. I've heard people here talking that they could go pick it up at the local farm supply store, which I know is only selling this product for horses, cows, and other livestock. Could you speak a little bit about ivermectin and whether or not that's effective, safe, or otherwise?
So I'll speak to the first one. Very, very early in this process, we did a Fairbanks study where we tested people. We just randomly chose people to come to sites and be tested. And it was very clear that 45% of individuals that tested positive were totally asymptomatic at the time they tested positive. So we know 100% that up to 48 hours before, and with the Delta variant, it may even be longer than that before you become symptomatic, you are infecting other people. So that's why this concept that people that are positive, as long as they're asymptomatic, can go to school, people that are close contacts when nobody's been wearing masks can go ahead and go to school, that's why that concept doesn't work. That is absolutely incorrect and not an appropriate or science-based decision-making process. Lindsay?
So I would say for the ivermectin, that studies have been done. Those studies have occurred to look at ivermectin and see if it is beneficial to help with COVID and it is not proven to be beneficial. So I do not go and take a medicine that is not prescribed to you and there's not evidence that it could hurt you, that it could help you because it actually could harm you. So I don't know honestly what else. Do you have anything to add about it?
The only thing I'll add is that there have been several articles about the increase in calls to Poison Control Center for people who have been very, very severely affected, ill from this, and even had to go to the hospital. So don't take a medicine that is prescribed for animals, especially large animals, that has not been proven to affect a virus or a disease. That's my recommendation.
Okay.
Sorry.
Our next question is from Casey Smith of the Associated Press.
Hi, Dr. Box, you said earlier it was disappointing that only about half of eligible Hoosiers have been vaccinated so far. I'm wondering if you have a goal in mind in terms of hitting some sort of rate of Hoosiers who are vaccinated and a timeline for that goal, especially with schools back in session and with this renewed strain on hospitals.
So I'm going to let Lindsay speak to this, but my goal is 100% of people. I mean, we've shown how many people are dying and being hospitalized and severely affected with this. So 100% of eligible people. But if we could even get to 70% of people that are eligible, we'll see a dramatic decrease in spikes and further surges. Lindsay?
And we've seen other states meet that number. I mean, those high numbers of vaccine rates. So we know that we can do it. It is incredibly heartbreaking as a healthcare provider to care for somebody who is sick and dying because they haven't gotten vaccinated. Young people, pregnant women, older people, and honestly, for a lifetime of being okay with people ignoring my medical advice, this is different, and it's feeling different for the healthcare workforce because it's not just them that's dying; it's the fact that they're infecting other people who are also getting very sick from it.
And a point that I think we made in our talking points, and that is it's preventing other people from having beds to get treated. It's preventing their non-emergent procedures, which could be something as simple as a biopsy to rule out cancer. So whether that makes a difference in their long-term health or it just makes a difference in the fact they live with the worry of that for the next 6 to 8 weeks. They don't have a bed to do the elective heart surgery and the other things. So it's not just affecting the people that are getting sick with COVID because they're not vaccinated.
Our next question is from Carolina with the State House File.
Good afternoon. I hope you're well given the circumstances. So my question is, based on the numbers you just shared and your comment about this being the darkest times of the pandemic, where do you see Indiana going given that certain individuals are not complying to COVID guidelines as they once did last year? Do you see improvement in the near future or probably worse results?
So the near future, the next 2 to 4 weeks, or even maybe as long as 6 weeks, no, things are going to get worse. If Hoosiers do not start wearing masks to prevent transmission and more Hoosiers don't get vaccinated, we are going to see cases continue to increase probably till right after Labor Day. And then we will see hospitalizations follow as far as their increase within that next 2 to 3 weeks. I think the thing we are able to really control by getting vaccines now is whether we have another surge this difficult and this bad later in the winter or in the early January, February time. Lindsay, do you?
I think we are fully expecting and preparing that things are going to get much worse with our hospitalizations here in the next 4 weeks.
Next up is Rich Nye, WTHR.
Just a second, folks, I'll be right there.
Okay.
If you're having some reporting issues from schools, do you have a good grasp on how much COVID is disrupting schools at this point? And is in-person classes actually driving some of what you would call the darkest time of the pandemic?
Well, most certainly having students in schools together and doing extracurricular activities is contributing to these cases. We could definitely decrease the number of cases and transmission if those students would be fully masked all day in school, all students, teachers, and staff. It is difficult to know exactly what's happening when schools are not willing to report cases and not willing to report close contacts. And we are working with the schools very closely and talking to the Department of Education about what future actions or supports could be given to schools that are doing the right thing here. And I think that's very important. There are a lot of schools that are working very, very hard to report their cases, and it takes them a lot of time to do the contact tracing, to call parents, explain the situation to them. So I really want to give a shout out to the schools that are doing that. That's very, very important. But I do believe that our data from last year clearly shows through the Department of Education that our students lost significant ground not being in in-person education, and truly believe that our schools believe and parents believe that students need to be in person in schools getting their education.
And our last questions are from Sherry with the Indy Star.
Hi. Last year, I guess in November, the governor unveiled the metrics map, which you guys still update weekly on your website. That is now more of an advice map than a recommendation map. And you yourself alluded to having elected officials made it clear they want to have their say in what's going on. At this point, do you feel like the state or local communities, the health departments need to be doing more to stop the spread? People are not getting vaccinated. This is not the first time we've heard you urge people to get vaccinated in this room. People aren't getting vaccinated. People aren't wearing masks. Hospitalizations are going up. Elective surgeries in our city are being canceled. Is there a point at which somebody has to do something to stop it, or do we just rely on individuals to do the same things we've been asking them to do for a year that they're not doing?
I am not sure, Sherry, what additional things to do. Even last year when we had a mask mandate, there were many areas of our state that chose to totally ignore that mask mandate. And we can show the data, how this is affecting Hoosiers, even Hoosiers that are fully vaccinated in their health care. And people feel very strongly that this is a personal thing that they want to have control over, and I understand that. I think this is a time where lives have felt very out of control for a lot of people across our state. And so the ability to have control over what they think is most important to them is something that is very difficult for them to give up. And I respect the fact that they had the right to make that decision for themselves and for their family. I do not understand how wearing a mask is so difficult for people to try to prevent transmitting this virus. I'm a healthcare professional. I've understood evidence-based information my whole life long, and Dr. Weaver deals with that every day. So it's hard for me to understand when I think very clearly the data and the evidence-based information shows that masks decrease transmission of this virus. And we know, and we've looked at the evidence for this vaccine, and we are incredibly blessed to have such effective vaccines that are as incredibly safe at the same time. So other than continuing to impress upon people the importance of this and the effects that their decisions are having on other Hoosiers across our state, that is where I am with this, and that's where I'm going to continue to be as a public health official. I will say that our local public health officials, for the most part, are doing this exact same job in their communities. Some of them are getting very positive responses and support, and some of them are getting very negative responses and no support.
Okay, we did have one more online question come in. So our final question is from Alex with Chalkbeat.
Hi, thank you so much. Hopefully you can hear me. I was wondering if you've been able to see any effects of schools' new mask policies on the number of pediatric COVID cases.
School masking on?
Yeah, if school mask policies are having an effect on pediatric cases.
So I can't say specifically that we have a study of Indiana's cases and masking, but there are other studies across the United States that have shown very clearly that if students mask, a great one out of North Carolina, where they basically looked at all of their students being masked in the classroom, in the schoolroom, or in the school building all day long, and they found a less than 1% to 2% transmission rate. And so they basically recommended out of that study from Duke and North Carolina's Department of Education that you probably don't need to quarantine students if everybody is masked and follows that mask enforced policy all day long in the school building.
All right, that concludes today's health briefing. Thank you.